You are watching the Wellness Hour, leader in medical news and information. I'm Randy Hours. Today's topic, new breakthroughs in the treatment of sleep apnea. According to my first guest, no more CPAP machine. With us, we have Dr. Lance Timmerman. Dr. Timmerman, welcome to the program.
Thank you.
Now, we've had you on the program before, talking about dental implants.
Correct.
But a big part of your practice is helping people, I guess, get off CPAP or stop their snoring. Is that right?
Absolutely.
Okay. Now, for people that don't know you, as a general dentist, you do a lot of things. Tell me some of the procedures you do.
Pretty much a mixture of just about everything. We have a lot of people that call my office their dental home. They get their teeth cleaned. They come in every 6 months. They get periodontal therapy, fillings, crowns, pretty much the whole range of services.
You're also a big cosmetic dentist.
I am known.
Like smile makeovers. What do you call it?
Yeah, I've known to do smile makeovers. That's kind of my reputation. In fact, that kind of gets in the way of other things that I do. I've seated a smile makeover, and the person asked me for instructions that they should tell their dentist on how to maintain it.
Okay.
I usually am confused. I kind of thought I was their dentist.
All right. And so you do dental implants. We've had you. So denture wearers go into you. You say no more dentures.
No more dentures.
And
we can, by using implants, we can either stabilize the denture or replace the denture completely.
We said no more CPAP. You say that you've had people that are using CPAP or not using CPAP because they can't tolerate it, that are no longer off with some of the treatment therapies you are doing. Is that true?
Yeah. Well, CPAP is kind of the gold standard. It stands for constant positive airway pressure. We're forcing air into a person that while they sleep. They're not getting enough oxygen when they sleep. There's an obstruction there. So they're wearing a machine to be able to breathe while they sleep. So
in the middle of the night, these are people that are really loud snorers. They're gasping
snoring,
for breath.
Struggling to breathe. But there are some people that aren't snoring at all, but they still have an obstruction. And it's kind of an unknown silent killer.
Is it true? I mean, you say they think they're sleeping, but they're not sleeping.
Right.
What does that mean?
Well, a lot of times their daytime sleepiness is a common concern. They're told that a lot of people are diagnosed with ADD, behavior modification. People are different than they used to be, and they're trying to find out why, what has changed. They don't know. Some people don't have a significant other. They don't have a bed partner, so that no one's telling them that they're not breathing. So they're kind of blind to their condition.
They don't know
they just don't know.
But with these sleep studies, you say they go to a sleep center, and you could tell me what takes place there. What happens at a sleep center?
Sleep center is essentially, it's like going to a hotel. You're checking in somewhere else other than your own bed. They hook you up, and it's kind of a crazy thing. They hook up wires to your head, wires all over the place.
They film you too.
And they're filming you the entire time to watch what's going on, but they're also recording data. If you're struggling to breathe, if you're or not struggling to breathe. There are some people that don't even try to breathe, and they call it central apnea. But there are people that have an obstruction, and we can see the raw data proving that you aren't breathing or measuring how much you snore.
Or they're waking up like several times a night?
Many times, 50 times an hour. I mean, you can constantly be waking up repeatedly, but they're never awake enough to realize that they were awake.
So the next day they're exhausted.
Their perception is they slept the whole night, but not enough sleep, and they're exhausted. Interesting.
Very interesting. So so you're a dentist.
I am.
And I am very skeptical.
I get that a lot.
That this works. But give me the philosophy. I mean, how does a dental appliance, and I guess you're custom making these.
Right.
How does it help with what only a CPAP could do?
Well, if we remember, many of us were trained with CPR, and in CPR there's the ABCs, airway, breathing, compression. Well, the first one is airway. So if we're usually tilting the head back and bringing the jaw forward, we're opening up that airway, allowing us to do the resuscitation. An oral appliance can actually bring the jaw forward as well. And by bringing it, so I even have an example of one type of custom oral appliance. And if you look, you can see that it's bringing the jaw forward. And
like creating an underbite.
Right. And this time on purpose, as opposed to if we're orthodontically trying to repair an underbite. So it brings the jaw forward, and the obstruction, many times the obstruction is the base of the tongue, or the tissues in the back that need to be brought forward to opening that airway.
It seems very simplistic.
The idea is pretty simple. The implementation can be complex.
Because, so obviously if they're breathing okay while they're walking around during the day.
Right.
And if they only have a tough time when they're laying down sleeping, it seems to me that it's pretty obvious there's some sort of only when you're laying down there's a blockage.
Right.
Right?
The obstructive sleep apnea is a nighttime condition because you're breathing just fine during the day. But it's when everything's relaxed, and relaxation is a problem. That's why One factor, alcohol consumption, is a relaxant. They go to sleep and they are even more relaxed, and so they'll snore more. A lot of people say I snore only when I drink.
And what's the connection there? If you're more relaxed, why do you snore more?
Because then the jaw is going to be able to relax even further back. And so, if you're laying on your back, then gravity is going to play into effect and bring your jaw backwards.
Okay. So this custom appliance, this is one of the ways I guess you do.
Right.
It can. I mean, do you have people that they've been using the CPAP machine, and then you make one of these custom fitted appliances, and immediately they're sleeping?
I tell them, as I deliver that very day, I say tonight is going to be the best night's sleep you've had in years. Even if they've been wearing a CPAP machine for years, and most people report after wearing a CPAP, if they wear it, that they had a good night's sleep from that. I always promise it's going to be a great night's sleep.
You told me right over there, though, that these people hug you. I mean, they're happy.
I get hugs. I get hugs all the time from the patients that we do. In fact, a couple days ago, we were doing a kind of a follow-up with a patient, and he was overweight, an older gentleman. And like most gentlemen, it was the wife that made the phone call, that kind of pushing them in the door to get treatment. While we were talking to him and measuring everything, she was up front telling our office how much that she was so happy to have found us, that it's changed her life as well as his. Okay,
you say people sleep in other rooms. I mean, the snoring is so bad.
Some people snore louder than a rock concert. And so, as a result, they migrate, eventually find themselves sleeping on the couch or sleeping in the guest room. And relationships suffer from that. So, in a way, I'm not a marriage counselor, but I'm helping marriages in regards to they're able to then go back in the same room.
Has anybody ever told you that? You saved their marriage?
I have, several times. It's because of their lack of communication and the little things that annoy them. They don't annoy them quite as much anymore if they get to share the same room.
I'm going to put you on the spot here. You told me, I guess in our green room, that you were a big-time snorer, and that you wear one of these.
I do.
You do?
I do.
Is it something like that?
It's actually identical. Can I show you what?
You've got one.
I got one right now. And
that's it. Okay, so you just put, that was fast.
That was the top part.
It was like sleight of hand.
So I'm wearing it. I can talk with it.
And you can sleep with it?
And it's sleep very easy.
Okay, now when you use this, now why the top one?
Top one is to
keep you from rubbing against
if I have my teeth separated, the teeth can move and orthodontically get crooked. And so the top one is there to kind of keep the teeth in place, so you don't create crooked teeth from wearing the appliance.
Yeah, when you don't sleep, because this is something you brought up that's very interesting, because you were telling me, when you don't sleep, it affects
your whole life. You're irritable. Well, at least I'm told that I've been irritable. My wife's very quick to point out that I would be irritable, kind of grumpy. I'm less tolerant of things. Little things put me on edge. I've had small children, when we've treated them, the parents come and thank me because they were ADD, and maybe it was a misdiagnosis, but that their grades
You've
improved.
Actually had kids where things improve?
They're almost like a different child. They're paying attention to school. They're not fidgety. They're sleeping through the night, whereas before they were just restless.
And these are just custom made for their little mouths. So what are signs do parents need to know? So if your kids are snoring, I mean, the kids shouldn't snore.
Snoring is the first thing to look for. If they are snoring, then there's probably an obstruction. Sometimes it's simple. Sometimes just an allergy, and we need to have an allergist look into it. And sometimes there's an obstruction, and we need to do something about the obstruction.
Okay. Now, what about doctors, medical doctors? What would they say to what you're telling me?
It's a medical condition.
Don't hold back here.
Okay. Well, it's a medical condition with a dental component. But a lot of the medical doctors have been prescribing CPAP for years, and that's kind of all they know. It's either a CPAP or there are some surgeries that they're going to be recommending. But as far as the dental component goes, they're skeptical that it's going to be effective. And I've had actually one doctor where he wouldn't kind of authorize or agree with the treatment. And that
Meaning he wouldn't, write a prescription, or he wouldn't?
He told the patient that this shouldn't be done. You need the CPAP, no ifs, ands, or buts. And so the patient being very trusting.
How'd they hear about you, by the way?
Well, I had a patient that had come to me, wanted this, and then they told their doctor that they were going to do this. And he just said, no, it's not going to work. You shouldn't do it.
Interesting. Okay.
However, they weren't wearing the CPAP machine. So it was either wear the oral appliance or nothing. So he said, you might as well give it a try. So they went and they had
So the doctor finally conceded and said,
fine. And I got a letter from him.
Why can't they wear the CPAP? What's the problem?
They just wouldn't. CPAP is like wearing an oxygen mask that, like in an airplane where they have the mask come down, you're trying to wear this device all night long while you sleep. It's not comfortable. And you have to stay on your back. If you go on your side...
Sleeping on your back the whole night?
Ideally.
Wow.
Now, there are some masks where they can really lash it down so that you can go on your side, but it ends up...
It's hooked up, it's a machine?
It's hooked up in the long tube to a little machine that kind of... It's kind of a hum. Some people exaggerate. It's not as loud as many people make it sound, but it's a noise. And some bed partners can't tolerate listening to the noise of the hum. It's as bad as the snoring. So they're trading one noise for another.
But CPAP works.
It works. It's very successful. I don't want to say it isn't good, but there are alternatives that many people prefer. In fact, I have a salesman. He travels all the time. And the TSA people can give him funny looks as he's checking in and trying to go through the TSA screen check. He's got this big machine and has to explain what it is. So he says, just for convenience, I want an oral appliance. Just so when I travel, I'll wear that. When I'm at home, I'll wear the CPAP. He liked the oral appliance so much better that he doesn't even wear his CPAP when he's home. He just continues wearing the oral appliance.
What about the over-the-counter? You could buy these, I guess.
You can.
Appliances. The
over-the-counter the devices, they do work somewhat for snoring. The problem I've got with that really is the people that haven't been diagnosed, they're treating a condition and maybe incomplete. Because really the snoring is kind of our warning sign. It's like having those carbon monoxide alarms in the house.
Okay.
It's silent, it's there. If it was making noise, you wouldn't just take the batteries out so that it wouldn't bug you anymore. If you're taking away the snoring, the apnea may still be present. You can have people that are a silent apneic, meaning the obstruction's still there, but there's no more snoring to warn you that there's a problem. And so that's probably the first thing that I have a problem with the over-the-counter devices. The other is many of them aren't custom. There might be a Boyle component to it where they can try to self-customize it, but most people report to me that they're really not that comfortable. They can move.
So these
teeth.
are more comfortable.
These are a lot more comfortable. These don't move teeth. A lot of the other people will talk about that they started wearing the other thing and it started moving their teeth, and they just had braces and they're upset because now their teeth have moved. So these will.
So you don't like over-the-counter?
Not really. I think
not really, or not at all.
Not at all. They're effective for people that are snoring. So if you already know that you have don't have sleep apnea and you're just noisy, if the over-the-counter thing works, I don't really have a problem with that per se. But really, it's only about 10% of the people where it's going to be okay.
I read an article, and you reminded me of it, that you say that there's certain the spouse, the partner, is worried about their husband or partner dying.
Right. Well, the condition itself is life-threatening.
And so they're stressed out.
Some people, they're not really...
Do you hear that?
Yeah, well, a patient just last week, she was saying that she didn't sleep at night, not because of the snoring. She could get through that. It was the anxiety. She was worried all night long that her husband was going to pass away in the middle of the night. And so as soon as we gave the oral appliance and the snoring went away and everything was resolving, she slept better because she was at ease. So it's not always just the snoring that causes the problem with the bed partner. It can be just anxiety.
Okay, but when you sleep, more energy, less appetite the next day, better concentration. You can start, you get a better workout at the gym.
I had one patient, you could tell he had a history of being fit. He didn't look as fit when he came to the office. And he was reporting that, he goes through the motions. He has the membership to the gym. He's got a routine to go there. But he's usually only there for maybe 5-10 minutes before he's kind of lethargic, just can't do his workout. And so within days of getting a better night's sleep, having the oral appliance in there, and when you start going to the gym, he actually could complete the workout more. He started losing weight because he was able to complete his workout like he used to. And he felt like his old self. He's returning to his youthful exuberance.
You mentioned that you wear this, and your wife was initially the one that talked you into this? Did you get the training first, and then she said, well, you should try this?
Yeah, as I was starting to treat other people, she was kind of calling me a hypocrite. And as far as she says, wait, you're treating the patients, because I do a lot of sedation dentistry as well, people that are scared to come to the dentist. And when people are sedated, they're more relaxed. And I was trying to complete my procedures, and I could see these people struggling to survive.
Interesting.
And so I thought, I think what I'm doing might be a little dangerous. So I was fully trained in life support, so that they weren't that much at risk, but I could tell there was a problem. So I was telling them, you need to go see your physician. After the sedation wore off, I said, you've got a condition. Now, I can't make a diagnosis. All I can do is send them on to a specialist and say, look, you need the polysomnogram, the sleep study.
Okay.
They need to be diagnosed from that. So my wife said, well, wait, you're showing signs too. You're snoring. You know, every once in a while, she's shoving me in the ribs, and I got to go in the other room. She says, well, you know, you should try look into yourself.
Okay.
So I ended up having a sleep study done too.
So, oh, you did?
I did.
And how long were you actually sleeping?
I was sleeping okay. Actually, my index number, or the number they give you when they diagnose, was normal. It's within normal limits. Everybody stops breathing a little bit. So a couple times a night, I was not breathing.
Like, what's a bad index number?
A bad index number? Well, it comes in three categories. An index number of 5 to 15 is mild. 15 to 30 is moderate, and above 30 is severe. Okay. And so anything over 30. I had one person, she was a 66. So this is severe. This is not good, you know, almost dead man walking. So we made an oral appliance for her. And after we finally found the right position, and these are titratable, meaning I can actually move the position better or worse. We can find the sweet spot. So we found the spot that was working for her. And so she went back to have a sleep study done. And the sleep doctor...
Well, when they tell their doctor, though, I mean, it's the doctor, they don't believe it?
Well, the doctor saw the study. He gave her a free second study another night because he figured there was something wrong with the equipment. He said, wait, it went from a 66 to a 0. So something clearly was wrong. So we did it again the next night and still had a 0.
So I put you on the spot on the telephone, but I said, look, I don't want to know how many exactly, but of the people that you've had come in, to the best of your knowledge, what success rate, percentage-wise, as of today's date of this show?
As of today.
What percentage?
Well, I hate to say 100% because it seems kind of far-fetched or hard to believe.
100%.
Yeah. I always hesitate to say 100% because it seems kind of far-fetched.
I'll have to have disclaimers all over this.
Probably. And if you quote me,
so far,
I'll say you're lying.
But in your experience, I mean, they've been off CPAP.
Every single one.
So this is your happiest group of patients?
By far the happiest group of people that we treat.
Is it the most fulfilling for you? Like, do you get excited when somebody comes in?
I do. This is the part where, you know, I'm getting the hugs all the time. You're getting a little tear in the corner. You know, everybody. It's a happy day.
Do you go home and tell your wife, like, you know,
every single
some
time.
of these stories?
Every single time. It's always exciting because she's now anticipating the treatment, so she's looking forward to the stories when I get home.
Good,
so that I can tell her how things are going.
So take me through the process of diagnosis. I mean, how soon do you know? I mean, do you have to make it, try it to know? Do you have any sort of predictability whether they're going to be good candidates or not?
Well, generally speaking, since I can't make the diagnosis, people are usually coming to me because they've already been diagnosed and have a CPAP machine.
Okay.
And so then I always want to see what their studies are, and I want to know what that number, they call it an AHI, or apnea-hypopnea index. I want to know what that number is just to kind of get an idea of success. And if I know if it's with 5 to 30, within that range.
Is that where you were?
And I was a 3. Okay. So I was easy to treat because I was just the snoring. But the people that are 5 to 15, 5 to 30, that's the mild to moderate. That's kind of an ideal thing for oral appliance. Now, even though I've had that study where the person had a 66, so she was still above 30, and it still worked. I just don't promise that I can help them as much as I'm going to promise the person with the 4.
Have you ever had somebody? But you've had people at the high levels with this help. Now, this is probably the best part of this interview, in my opinion, is. And I asked your permission if I could bring this up because I think it's a great story. Your parents.
My parents.
Husband and wife,
love
both
their
wearing
CPAP.
CPAPs.
CPAP compliant. They are the poster children for CPAP compliance. They love it because they know how it feels before they were diagnosed and started wearing it. And
they go camping with it, you said?
My dad, it's funny, he likes to boat in the San Juan Islands. There's an island between Seattle and Vancouver, British Columbia. And he goes camping on his boat, and he'll rig a car battery, a diehard, to be able to then power his CPAP machine while he's off in the middle of nowhere. And so I told him, Dad, an oral appliance is an alternative to diehard.
They say parents that their kids are doctors, they don't take the doctor's advice if it's their kid. So, I mean, what do they say when you say, hey, Dad, Mom, give it a try?
Well, they're usually nice, and they'll say, well, okay, eventually. They just don't schedule the appointment. Or they'll schedule the appointment, and then they'll come up with have to cancel the appointment and reschedule.
Yeah, but you literally can't talk them into it?
Nah.
Are you convinced, though,
I know.
that no more CPAP?
Well, I know that I could replace their CPAP.
Really?
Yeah.
So you know their sleep numbers or whatever those numbers are?
They're totally within treatable amount. They'd be easy to do.
So they just don't believe it?
No, they're just lazy.
Too hard to believe?
It's their son. They're lazy. They got things to do.
Is that rare, by the way, that the husband and the wife, or the partners both?
I don't know of anybody else besides my parents where both of them have the dueling CPAP machines going.
This has got to be a funny story. When you go to these sleep, and by the way,
Yeah.
are you part of these sleep societies, or
Yeah,
what are there?
American Academy of Dental Sleep Medicine.
So you guys get together and do what?
We get together and we talk about different new advances in the designs of the different oral appliances. There's different ways that we can treat, and we kind of talk about the different success stories. Any challenges we might have, it's always nice to have someone else come up with a solution. And so if we come across a similar situation, oh, I remember so-and-so had the same thing happen to them, and this is what they did. So.
Do you share that story about your parents, though?
All the time.
That seems like a funny story.
Oh, they make fun of me all the
What
time.
about a CPAP intervention?
Oh, I
where
should.
you get people
Right.
together, other doctors,
Right.
and say, look, try this, do it. Well, good for you. Okay, so the process. They go in. What's that look like or sound like?
The first one is I like to sit down and look at the number, explain their sleep study. A lot of the time, they've had the polysomnogram or the sleep study, and no one ever told them what it meant. And so they're just kind of going on faith that there was a problem. So I'll show them.
You've had training on how to
interpret
these.
that.
Okay.
Right. You know, kind of the basic level. I'm not a replacement for the sleep physician, but I let them know their condition. Here's where you weren't sleeping. Here's where you almost died here and here. And so then we say, okay, we talk about your options. The CPAP is the first option, but they've already explored that. That's why they came to me. The other option is surgery. You know, so there's a thing called UPPP. It's the uvulo-palatal-pharyngoplasty. That's where they take away that little thing in the back of your throat that dangles. They can cut that off. Sometimes that's the obstruction. Sometimes the tongue is too big, so they make the tongue smaller. Or sometimes they need to bring the tongue forward. You can surgically advance your tongue and tack it to the jawbone. And it works. I have a patient who had that done, and he loves it. He's no longer snoring and no apnea anymore. But surgery is usually kind of a last resort. Most people don't want surgery.
Well, obviously, I mean, if people were convinced that this were worth a shot, they would all do it.
Exactly.
They would all try it. I guess, is that the tough part, the selling of it? Getting people to believe that this is a real option?
Sometimes it just seems too good to be true.
Yeah, it does. I mean,
Wearing
even
something,
listen, it seems simplistic.
It does seem that way, but the success speaks for itself.
So this is kind of spreading across the country.
Right.
More and more dentists are learning to do this.
More and more, it's an underdiagnosed condition. Many people have it and have been diagnosed, but there are a lot more people out there that haven't been diagnosed, and the diagnosis is increasing, and so it's becoming more aware. People are becoming more aware of the condition, but maybe not the options of treating it.
Now, what about insurance? Will it cover like a small portion? Sometimes,
lots of times there's nothing out of pocket. We've had really good success with medical insurance. It's a medical condition.
Oh, it's a medical insurance.
Right. So medical insurance on a medical condition with the dental component, so we get to be the ones to interpret.
So if a medical doctor writes a prescription for it,
correct,
it will be covered most of the time.
Within every insurance has its contract limitations and the creative wording, but usually sometimes it's just the deductible.
But you get it covered weekly, would you say?
Yeah,
monthly?
all the time.
Oh, so you get it covered. So it's worth a shot. I mean, if you're stuck wearing a CPAP,
yeah,
it's worth a shot. And these people have more energy. Obviously, they feel better.
Right.
Very interesting.
Yeah, medical insurance, I mean, they're notorious for not wanting to spend money, and this is one where they almost always will pay, because it's connected to so many other things that cost the medical insurance a lot of money.
Now, doctors will, and we're almost out of time, but they will watch this show.
Okay.
They don't like to admit it.
Right.
But what do you want the primary care physician, because I'm sure they're skeptical about this. You told me they are.
Always.
What do you want them to know about what you're doing and why it would be beneficial for them to at least get a consult with you?
Well, I'd want them to know that this works. Like I said, I'm batting 1,000, so it's not really a risk. It's worth a shot if they've got patients. I mean, truly, ultimately, we're trying to help people, and if they are truly trying to help their patients, then they should give this a shot.
So, would you say that this should be first-line therapy? I mean, if somebody has been diagnosed with sleep apnea, at least try the appliance first before going to CPAP?
I think so. Well, the guidelines from the
American
American
Medical
Medical...
won't happen, right?
Probably not. But the guidelines set forth by the American Medical Association said that the oral appliance therapy should be the first line before all the others, especially for mild and moderate cases. So, truthfully, yeah, I think this should be the first thing that people...
in these sleep apnea patients, is there a certain age? I mean, is it more men than women?
No, it's about 50-50.
Really?
Yeah.
But does it always start with snoring, by the way?
It's usually the first thing that they notice, but it's not always just
so
the snoring.
Somebody watching this, if your partner snores,
it's
great for snoring, though.
It's wonderful for snoring, but it's also, if somebody watching, if they find themselves falling asleep during their commute, driving to work,
tired during the day,
all the time, irritable, they're just not their old self. That might be a sign as well.
You wear this and you say you feel so much better.
I feel great.
Do you ever get wisecracks from your wife saying, "Oh, looks like Dad didn't get the,
Yeah.
Because you have 4 daughters, right? 3 daughters?
3 daughters.
Do they want to be dentists, by the way?
None of them.
None of them want to be dentists? But do you get wisecracks? Like,
always.
I don't think
if I get grumpy for whatever reason, it's like, did you wear your appliance?
Even the daughters say that as a joke?
Yeah.
That's classic.
Yeah.
Okay, so it works.
It does.
And are there studies or is anybody doing anything published on
all the time.
appliances?
All the time. They're continually coming out with new studies showing the efficiency of it, whether it being a replacement for CPAP or combining CPAP. So
now you have this specific training in your bio where you really understand the bite with
Correct.
this Las Vegas Institute.
Uh-huh.
You have electrodes, I guess, or something that hook up this neuromuscular dentistry,
Right.
I guess. Does that make you better at treating sleep problems?
I think
Do
so.
you think?
Well, everything.
And if so, how so?
Well, I can make sure everything is precise. We're not guessing and kind of throwing it against the wall, see if it sticks. We're actually dialing in.
Like dialing in the bite, the way the teeth.
See what the muscles are doing. We can see how things are reacting. So we're kind of cutting to the chase. We can be more efficient, fewer visits. So.
Have you had patients where you're a little bit nervous? Boy, I don't know if it's going to work for this person.
Yeah.
And then they come back and they're off.
There are a few people where I'm like, well, we'll give it a shot. And then when they come back, and I always ask them, tell me how you feel. And they'll come back with a story of...
Like what?
Where one guy had gone to Hawaii. In fact, normally we like to call the next day to verify how things are going. And he went to Hawaii for 2 weeks. Didn't hear from him. I was afraid he died, and we didn't hear back. So he finally comes back. He says, I haven't slept that well in years. And my vacation was best vacation ever. So there are times where I'm not sure it's going to work. And then I
love it.
I'm
so it's just
batting 1,000.
Getting the word out,
Yes.
going for a consult, and chances are it probably is going to work.
Probably.
One way or another. I want to thank you for coming on the show.
Thank you.
Good for you. Good for you. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again, or a friend of yours has sleep apnea or is suffering having to use the CPAP, they could go to my website at wellnesshour.com, put in sleep apnea or Dr. Timmerman. Dr. Timmerman, or visit his website. You can find him there. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.